name is Amanda, and today we'll be performing the oral medications video for MAR number 3. Here I have all my supplies. I have my patient, the cup for the patient, my gloves, the 2 cups for the medication, and my hand sanitizer, and my Tylenol here as well. So 4 medications. I have a paper towel just in case I need to wipe anything off or clean the patient or clean medication. I previously had already opened on medication for another video and I threw away the packages, but I do have the medication here ready to go, and I'll go ahead and explain all that as well. So I'll go ahead and check all my medication with the provider and as well as in the EHR before I go ahead and go in with my patient. And right now I have amoxicillin for 250 milligrams. I have the metformin for 500 milligrams, and then I also have the Benadryl for 25 milligrams. Then I have the Tylenol, the liquid Tylenol here, or acetaminophen, 500 milligrams for 15 mLs. And then, so I will gather all my supplies, take everything in, knock on the door, let the patient let me in, close the door or the curtain, whatever room I'm in, and then I will introduce myself, let them know I'm the nurse, and I'll be giving them their medication and explain everything to them as well. We'll just take a few minutes. Also verify the patient's first and last name and date of birth and the wristband. Everything seems to match. Go and ask them for allergies. And no known allergies that they know of right now. Next, I'll go ahead and perform hand hygiene, do all that, put my gloves on here. And then before I administer the medication to the patient, I will go ahead and review common side effects and adverse side effects and just explain to them what they are. Common side effects are side effects that just happen often when taking medication, and then adverse side effects are side effects that I need to know immediately because they're very life-threatening. And so first I'll go ahead and start with the amoxicillin. Let him know that it's an antibiotic, it's 250 milligrams, and common side effects are nausea and diarrhea. Put that in the cup there, pretend it's in the package, and open it up. The next I have the big pill here. It's metformin, 500 milligrams. Common side effects are decreased appetite and diarrhea, and adverse side effects are abdominal pain and heavy breathing. I'm going to put that in a cup there, shallow breathing. And next is Benadryl for 25 milligrams. Go ahead and put it in the cup here, and go ahead and let him know that the Benadryl is for allergies. And sorry, I don't think I said that in the metformin it's to control blood sugar. That's how we're giving it to him. Back to the Benadryl, that's for allergies. And common side effects are drowsiness and dizziness. Adverse side effects that I need to know immediately are urinary retention and seizures. And then lastly, I have my liquid Tylenol or acetaminophen here. I'll go ahead and give that to him as well and just explain to him that if it is ordered for a doctor, and before you even give any type of pain medication, you do need to have some type of like pain scale or pre-assessment prior to giving the medication. You can't just give them, pain medication because they haven't asked for it or said anything. They kind of have to let you know, oh, I'm not feeling well, before you let the doctor know and they place the order and all that. So a pre-assessment does need to happen, like I said, or a pain score. You can't just give it to them. But common side effects are drowsiness or dizziness and nausea. Adverse side effects are jaundice and black tarry stool. And I'll let the patient, before I begin, ask them if they have any questions for me. Great, no questions. So I'll go ahead and grab the cup here, put liquid that they prefer, either water or cranberry juice or orange juice, whatever they want at the moment. They can have generally just water, but again, they can switch it to whatever they want. So first, the patient is in good position. They're ready to take it. They look all right. And then I'll give them the medication and they can take it all at once. I personally love to do one at a time. I can't just stick them all in my mouth and swallow. So make sure they take the medication here, give them that, and give them some water. Okay, and then just make sure that they swallow and everything looks okay. You haven't noticed anything off, or they're not coughing or choking, things like that. And then next I'll go ahead and administer the liquid medication. Again, here I have acetaminophen, 500 milligrams, 15 mLs, and I will go ahead and make sure I have a flat surface. Open it up here, put the lid upside down, get down to eye level and pour out 15 milligrams here. Perfect. And then and also didn't explain, but go ahead and cover the label just in case anything drips on it. You want to make sure that stays clean so that it's legible and you're able to read it down the road again. Go ahead and clean off the top here. Put the lid back on. Again, if you see any spillage, go ahead and clean it again. Put that on there. And then I can see it's 15, but not sure if you can. It's about halfway filled, so right at the 15 line. Just holding it there so you could see it. And then give it to the patient, let them know, here's the liquid acetaminophen, perfect. And then give them the liquid that they like. Awesome. And then again, make sure the patient is in a good position. If they, if I had them sit up, maybe sit them back down. Put the rails back up, whatever you're doing. And then I'll remove my gloves. Perform hand hygiene. And ask the patient if they have any questions before you leave. And give them a call like. Again, make sure they're comfortable. And when you document, make sure you're documenting the right patient, right medication, the right dose, the right time, and the right patient. I hope I said right patient. Again, hand hygiene. And in the beginning, before I went into the patient's room, I should have stated the 6 rights of medication, which are, or before you administer medication, which are the right patient, the right time, right dose, the right documentation, right route, and the right drug as well. So make sure all of that is being analyzed and looked at before you actually go in to the patient, because that is a big thing to do. And then lastly, perform hand hygiene like I did. Make sure the patient's okay. Give them the call light. Ask them if they have any questions or anything you can do for them prior to going back to your station. And yeah, all done.